Gastric ulcers, peptic ulcers, gastritis are very, very prominent and very, very common in our society today. What are we actually doing, or what are we actually eating that is making this disease, this problem spread so widely? And why is it so difficult to control, manage, and treat gastric ulcers, peptic ulcers, or stomach ulcers? Good day, everyone. I'm Gwendolyn Hale. I'm a medical microbiologist certified in the UK, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health, medicals, hygiene, some farming because I love farming, and business, of course. I'm an entrepreneur. Stay tuned. We'll be looking at treatment prevention of gastritis, stomach ulcers, and peptic ulcers. Now, knowing the prevention is more important than the treatment, because then if you're having the episodes, you know how to manage the problem or the disease. But if you have no clue on what could really trigger you to have gastric ulcers or peptic ulcers, you may just be doing whatever you want. And I would like to say gastric ulcers, peptic ulcers, and gastritis, acid reflux, are very difficult to treat or manage. That is why most patients who find out that they have, particularly the ulcers, go on a very strict diet. They're always moody. They have a very bad metabolism. In fact, the pain, the excruciating pain, that they experience is something to take home. I'm telling you, it's so bad. Now, the first thing I'm going to say on how to treat and prevent gastric ulcers, peptic ulcers, and gastritis is be conscious of the food that you are eating. Avoid milk, fizzy drinks, coffee, alcohol, spices, like too much what the Indian people will say, masala, especially chili. I know there's cayenne pepper that is good for the health, but take it in little, like real tiny, mini quantities. Also, you have carbonated and fizzy drinks like Fanta, Coca-Cola, Sprite, and also greasy or fatty foods. Now, the reason why I'm naming this is because they actually stimulate the stomach to produce a lot of acid, hydrochloric acid in this case. And it's this hydrochloric acid that irritates you and causes gastritis, peptic ulcers, and gastric ulcers. And most times or sometimes holes in your intestines or stomach. So this is what you should control. Just prevent it. And if you want to treat it, this is how you should. You should basically just stop taking all of this. The next point is don't eat in large portions. Eat in tiny little beanie portions spread over a period of time. Now, I will say this. For example, in an hour, you can eat twice in an hour, but small portions of what you would have eaten once for lunch. Next point is drink a lot of water. Drink a lot of water before and after meals. For adults, drink 500 milliliters before meals and 500 milliliters after meals. Drinking water before meals would actually help to dilute, before and after meal, dilute the concentration of the hydrochloric acid that has been produced to help with the digestion of the food that you are going to take or you have taken. The next point is to treat it and to reduce the pain is try to lie often on your back. Sleep often on your back. And raise your torso. That means you put pillows on your back and raise your back and you sleep more elevated. That means the upper part of your body is slightly elevated. This is going to help to reduce the pain. Stop smoking tobacco. Stop smoking. Smoking irritates it even more. Smoking will make your gastritis or gastric ulcers or peptic ulcers even worse, especially tobacco. The next point is drink aloe vera. Aloe vera has been proven to actually gradually treat the sores, the wounds, the irritation in the stomachs and in the intestines that would have been caused by ulcers or by the hydrochloric acid. So you take aloe vera, the slimy part of the aloe vera, you make it into a juice. It's normally bitter. You take a glass a day, or 2 glasses a day, in the mornings and in the evenings, like before bed. And I'm telling you, you will notice a good relief from these treatments while taking aloe vera. A drug I want to propose for you is pantoprazole, a gastro-resistant tablet. This is 40 milligrams, and the active ingredient here is pantoprazole. And you could take this, you're supposed to take once a day. You take 1 tablet like an hour, 30 minutes before you eat. And I'm telling you, it will heal. It helps to control. It will actually treat you in long term. And if you don't find the 40 milligrams, you can buy the 20 milligrams, and you take 1 in the morning, 1 in the evening, but all before meals. Don't take any after meals. And also, to prevent and treat ulcers or gastric ulcers or peptic ulcers, please avoid tension, stress, because it would increase the acid produced in your body. Please try and control, your emotions or what happens around you. Don't allow what happens around you to actually affect your health. Tension, anger, stress, it will increase the amount of acid produced in your body, in your stomach. And that's not going to be good for you. So control that. Keep that at a minimum. And I have 2 cautions to give you. First, avoid NSAIDs, non-steroidal anti-inflammatory drugs. That includes ibuprofen, aspirin, paracetamol. You also have a mefenamic acid, which is part of them. If you have to take them, please ask your doctor for an alternative. Some doctors give tramadol, which is for pain. Some doctors have alternative. Some doctors will prescribe Tylenol, because it's less irritating, for someone who has gastric ulcers or peptic ulcers. And don't just take these drugs anyhow, ibuprofen, aspirin, paracetamol, because it's an over-counter drug. Don't do self-prescription or self-medication anyhow, because these drugs in long term have a lot of side effects in our body, guys. Please. And finally, if you're taking sodium bicarbonate, which is also a good antacid to help with gastritis, gastric ulcers or peptic ulcers, either in prevention or in treatment, please do take it with caution, because in long term, it will become toxic to your body. Very toxic to your body in long term. So please make sure you follow these DIY remedies I've given you, and you'll be okay. you will be okay. God bless you. Thank you so much for staying tuned for this short teaching, and bye-bye.